So GVHD, or graft-versus-host disease, is an immune reaction where the donor's T lymphocytes recognize minor antigen differences on the surface of the cells of the patient and try to react against them. In a sense, the graft tries to reject the patient instead of the patient rejecting the graft. And we talk about acute and chronic GVHD. By definition, acute GVHD is any reaction that occurs within the first 100 days after transplant, and chronic GVHD is reactions that occur after 100 days. But that's somewhat oversimplification. There are some differences in the mechanism of those reactions, and there can be overlap. So some patients may have what looks like chronic GVHD earlier than day 100, and conversely, some might have acute GVHD that comes on after day 100. But that remains one of the biggest challenges to success from transplantation. And fortunately, there are some improvements being made. Ironically, Ruxolitinib, which is the drug we use as our JAK2 inhibitor for treating myelofibrosis, was just recently approved as treatment for refractory acute GVHD. So it does inhibit the JAK2 STAT pathway, which is important in these inflammatory immune reactions as well. We and others are trying to study what's the best way to use JAK2 inhibitors in the context of transplantation in terms of pre-transplant, peri-transplant, and post-transplant. And we have a trial at City of Hope where we're giving our patients Ruxolitinib from day -3 through day +30 of the transplant procedure to see what impact that might have on some of the morbidities that can occur, including the incidence of graft-versus-host disease.